The KeraKlear artificial cornea is the only minimally invasive foldable artificial cornea that is designed to be placed into a non-penetrating corneal pocket. Placement of the KeraKlear only requires removal of approximately 5% of the recipient corneal tissue. The KeraKlear is made from a proprietary acrylic-based material. The optic is 4 mm in diameter and the overall diameter is 7 mm. Here we see a diagram of the KeraKlear implantation using a femtosecond laser. In diagram A, a femtosecond laser is used to create an 8 mm lamellar pocket in the cornea at a depth of 300 microns. In diagram B, the femtosecond laser has been used to create a 3.5 mm diameter trephination incision to a depth of 300 microns. In diagram C, this 3.5 mm diameter of diseased tissue is then removed. This disc of tissue represents approximately 5% of the corneal volume. In diagram D, the KeraKlear is then inserted into the corneal pocket using a smooth forceps, and the rim of the implant is placed into the recesses of the pocket with a smooth spatula. In diagram E, the KeraKlear is shown in place with optional sutures. Notice that the posterior cornea remains intact during the procedure. Here we see a femtosecond laser creating the 8 mm diameter corneal pocket at a depth of 300 microns. The laser also creates the 3.5 mm trephination incision. In the following case, a Zemer crystalline femtosecond laser was used to create the corneal pocket using its corneal pocket software. Here we see Dr. Vargas implanting the KeraKlear into a corneal pocket. The 4 mm optic of the KeraKlear replaces the central anterior corneal tissue. Smooth forceps and spatulas are used so that the KeraKlear implant is not damaged during implantation. Care is taken to spread out the rim of the KeraKlear 360 degrees. Optionally, sutures may be placed to further secure the KeraKlear. Here we see the pre-op photo of a patient with a history of multiple failed corneal transplants. The preoperative visual acuity was hand motions. Here we see the postoperative appearance of the KeraKlear after implantation. Within 2 weeks, the vision had improved to 20/60 and has remained stable over 16 months. Here we see the preoperative appearance of a patient with a corneal burn. After the corneal pannus was removed, the KeraKlear was implanted. At 4 months, the patient's vision is 20/20. This patient had a history of RK and stromal dystrophy as well as myopic macular degeneration. During the implantation, one of the RK incisions split open and had to be sutured. Postoperatively, the patient's vision improved to 20/80, which was limited by the myopic macular degeneration. Dr. Vargas has performed KeraKlear surgeries on 19 patients. The preoperative diagnosis of these patients included failed grafts, corneal scars, burns, dystrophies, and keratoconus. The preoperative vision of these patients ranged from 2200 to hand motions. The postoperative vision range from 20/20 to 2100, with all patients improving vision. There were no significant complications. In conclusion, the femtosecond laser enables the simple implantation of the KeraKlear artificial cornea. The procedure is minimally invasive and the anterior chamber is not violated. Only about 5% of the corneal tissue is removed in this procedure. The KeraKlear may be used as a first-line treatment for cornea blindness when corneal tissue is unavailable or when corneal transplantation has a poor prognosis. Because this procedure is non-penetrating, DALK or PKP can still be performed if necessary.